I'm going to talk about the difference between inpatient hospital admission and being admitted for observation under Medicare. It's important, so stay tuned. I'm Keith Armbrecht, founder of MedSup Savings. I hope you'll find the information in this video very helpful and presented in an easy to understand format. Turning Medicare eligible is actually a very good thing. You'll likely find Medicare to be a much better alternative for your health insurance needs than what you may have had previously. But there are some choices. So I've created a Medicare Resource Center where I have a complete video library on everything Medicare. You'll also find all the necessary links and the guides and the forms that go along with them. So please, after this video, take just a few minutes to explore our Resource Center. You'll likely find everything that you need for Medicare. You can also get an immediate quote for your Medicare supplement insurance. Just fill out your basic information and it will provide the rates for the plans that are available in your area. It would also be a really good idea to subscribe to my YouTube channel. That way you'll always have access to my videos and you'll get updates as they come along. So again, I hope you find this information very helpful, and please let me know if I can help. Okay, this is an important video. I want you to be able to understand how Medicare functions in a hospital setting. There is a big difference between being admitted to a hospital for observation or going in as inpatient admission. And I'm going to show you the differences between the two. Now, this is a video I had planned to create, but I just haven't gotten around to it. But I just got a phone call from someone that is in this situation right now, and it is affecting them financially on a pretty significant basis. So I'm going to show you what you need to understand. And I have a PDF here that's from the Center for Medicare Services. This is their guidelines. And unfortunately, you're not likely to find this video until you're already in this position. So hopefully somehow you've stumbled across it. You'll understand what the parameters are and you'll know how to manage things if it comes up for you down the road. So, are you hospital inpatient or outpatient? And most people think if you go into the hospital, you're hospital inpatient. So you can see here that, did you know that even if you stay in a hospital overnight, you might still be considered an outpatient? Now, most people would go, no, I'm overnight in a hospital. I've obviously been admitted to a hospital. And the big problem here is the hospital doesn't tell you whether you're being admitted for an inpatient or whether you're in for observation. So you need to ask that question. You need to understand whether you're being admitted for observation, then you can make some decisions yourself. You are an inpatient starting when you're formally admitted to a hospital with a doctor's order. The day before you're discharged is your last inpatient day. So not the day that you leave. You've been there overnight. You leave at 11 o'clock in the morning, noon. That is not part of your hospital admission. It's the day before is the last day of your hospital admission. Now, you are an outpatient if you're getting emergency department services. And I don't know why they call it emergency department. I've never in my life heard it called emergency department, but that's emergency room services, observation services, outpatient surgery, labs, tests, x-rays, other hospital services, and the doctor has not written an order to admit you to the hospital as an inpatient. In these cases, you're outpatient even if you spend the night in the hospital. Now, this person that just called me on behalf of her mother, who's 83, who broke her arm. And she was in the hospital for 3 nights and not admitted to the hospital. She was in for observation. I'm going to tell you where that's going to become a problem here shortly. So observation services are hospital outpatient services given to help the doctor decide if the patient needs to be admitted, so forth and so on. The decision for inpatient hospital admission is a complex medical decision based on your doctor's judgment and your need for medically necessary hospital care. Now let's understand, why would a hospital not want to admit you? Quite simply, there's pressure from Medicare, and rightfully so in a lot of cases, that it's a kind of a fine line. It's a much more expensive bill if you're admitted to the hospital as opposed to if you're in for observation. So Medicare obviously discourages admission when it's not necessary. Hospitals would like to admit you even when it's not necessary because they'll make more money. So it's a little gray area, fine line on figuring exactly how that works, but you need to understand for yourself what the parameters are. So we're going to go into what do I pay as inpatient. So if you are admitted to the hospital on inpatient, boom, shifts over to your Medicare Part A benefits. Part B is the one that covers the outpatient. So Part A covers inpatient. Medicare Part A covers inpatient hospital services. Generally, this means you pay one-time deductible. Right now, it's $1,260 for all of your hospital services for the first 60 days you're in the hospital. Medicare Part B covers most of your doctor services when you're an inpatient. You pay 20% of the Medicare approved amount for doctor services after paying the Part B deductible. Now, that's where Medicare Supplement would come in. It would cover that Part A deductible. It would cover the Part B coinsurance, so forth and so on. What do I pay as an outpatient? Well, no more Part A. Part A ain't going to pay anything as an outpatient. Part B covers outpatient services. Generally, this means you pay a co-payment for each individual hospital service. Not really. It's generally an 80-20, so I'm not sure what they're referring to with the co-payment there. It's coinsurance. It's 80-20. Your supplement would cover that 20%. Notice the co-payment for single outpatient hospital services can't be more than the inpatient hospital deductible. However, your total co-payment for all outpatient services may be more than the inpatient hospital deductible. Part B also covers most of your doctor's services when you're a hospital outpatient. You pay 20% of the Medicare approved amount after you pay the Part B deductible. And again, that's where supplement would pick that up. Generally, prescriptions and over-the-counter drugs you get in an outpatient setting like emergency department, sometimes called self-administered drugs, that's the ER, are not covered by Part B. Also, for safety reasons, many hospitals have policies that don't allow patients to bring prescriptions or other drugs from home. So you'd have to buy new drugs. Even if you have drugs that you already have, you'd have to buy new drugs at the hospital. If you have a prescription drug plan, these drugs may be covered under certain circumstances. So let's kind of clear that piece up a little bit. And it's not a big piece, but it's certainly a piece. If you're admitted into the hospital, chances are Medicare is going to cover the drugs that are administered in the hospital. But if you're there under observation, chances are it's going to fall to a drug plan instead of Medicare. So that's an important distinction right there. And it has some information for more detailed stuff. So let's get into some examples on which is which and how it should kind of play out. Now, so situation, you're in an emergency room or an ER, and then you're formally admitted to the hospital with a doctor's order. Okay, so inpatient or outpatient? Well, you're outpatient until you're formally admitted as an inpatient based on your doctor's order. Inpatient following such admission. So you may have been there for an entire day as outpatient, and then once the doctor admits you, then you become inpatient. Part A pays that inpatient part. Part B pays doctor services. Next one, you visit the emergency room and are sent to the intensive care unit for close monitoring. You're going into the ICU. You would think you're going to be admitted in the hospital, but not always. Your doctor expects you to be sent home the next morning unless your condition worsens. So you're spending the night in intensive care, but you are under observation. So what does Part A pay? Nothing. Part B pays your doctor services. Still okay. It's really not, that's kind of pragmatic. The only difference there would be the drugs on how that works. So you come to the emergency room with chest pains. Hospital keeps you for 2 nights. 1 night is spent in observation. Doctor writes an order for inpatient admission on the second day. So inpatient or outpatient? Outpatient until you're formally admitted. So Part A is going to pay the deductible, which is at $1,260 for the second day, and Part B is going to pay your doctor services and things of that nature. So let's kind of figure out where this really affects you. And I'm not quite, yes, we'll talk about it here. This is where it's really going to affect you. Skilled nursing facility. And this was the phone call that I just received. This woman, 83 years old, broke her arm, went to the hospital, was in the hospital for 3 days. They did not admit her to the hospital. They kept her for observation. So, Part B is going to pay that instead of Part A. Not too big of a deal. Where the big gap is rehab. So she was then sent from the hospital to a skilled nursing facility for rehabilitation. where she is obviously staying overnight and multiple nights, and she is now paying out of pocket $350 a night for the skilled nursing facility because she was not admitted into the hospital. If she had been admitted into the hospital, Part A would cover up to 100 days in the skilled nursing facility. So that is the biggest distinction on what you need to know between inpatient and observation. If you go in under observation, drugs aren't going to be covered in the hospital, and skilled nursing is not going to be covered outside of the hospital. If you go in as inpatient, drugs are going to be covered, and skilled nursing is going to be covered. So most people have no idea until they hit this. And like I say, the biggest problem is the hospital doesn't tell you this, and they absolutely should. They absolutely know what is going to transpire and what's going to happen when you leave the hospital, especially if you go into skilled nursing. They know. So just make sure to ask. And I don't know that you can demand to be admitted to the hospital for inpatient. You can choose not to stay at the hospital for observation. That might not be the wisest choice either. But at the end of the day, you have an understanding. So we don't want surprises. We don't want unexpected financial hardships. So this is the thing you need to understand about how Medicare functions in the hospital. And I will put this form on my website in the guides and forms. So if you want to go to MedSup Savings and just download this form, or you can call me, I'll be happy to email it to you. But it gives you the information that you need to make the right choices. So I hope you found this helpful. And if there's anything that I can do for you, give me a call. I hope you have a fantastic day. Thanks.